Hey everyone, it's Katie Golden. The deadline for patient input to ICER is this Tuesday, May 8th. This is crunch time. Even if you wrote to ICER in the fall, we really need you to write another letter to ICER in this open comment period. We need an army of migraine patients to write to ICER. Let me give you a quick rundown. ICER is the Institute for Clinical and Economic Research. Why are they important? Insurance companies will use ICER's final report when determining how they will cover a new medication that comes to market. And why do you care? CGRP. This month, the FDA will rule on this groundbreaking drug. It's the first migraine prevention drug to be developed in decades. Assuming it's approved, we need access to it, right? So, and if your doctor prescribes a CGRP inhibitor drug, you're going to face these questions. Well, how much is it going to cost? Will my insurance company cover it? What will my copay be? And this is where ICER's final report comes into play. Their research and report won't be finalized until June 14th. However, for patients to give their input and to write a letter, the deadline is this Tuesday. This is our last chance as patients to help them understand how debilitating our disease is and that we need access to these medications. This is your story to tell and your chance to be an advocate for not only yourself, but for all of us who live with this. We gotta flood ICER with our comments. So do you wanna be part of the army? Details of your mission can be found in the patient input guide. I worked with HMPF, the Headache and Migraine Policy Forum, and CHAMP, the Coalition for Headache and Migraine Patients, to put together a patient input guide that will give you some guidance on writing your letter to ICER. Visit the advocacy tab at headachemigraineforum.org to find the patient input guide. The guide includes key points to include when composing your letter to ICER. So share your story. Be bold and be graphic. Describe the negative and disabling impact that migraine has on your life. Tell ICER that existing medications haven't worked for you, that we need access to better medications. Call on them to appropriately value your pain and disability and support both episodic and chronic migraine patients in having access to these new CGR inhibitor drugs. So check out the guide, which goes into a lot more detail, but don't be overwhelmed. You don't have to write a novel or spend hours on this. Focus on telling your story so that they understand that migraine is not just a headache. It's important that ICER sees we are a united and strong community. The more letters that they receive, the louder our voices become. We want ICER to use their role responsibly and support migraine patients in getting access to these desperately needed new medicines. Join the Migraine Army. Write a letter to ICER.